All right, welcome back. It's still Breakfast Daily, and we're going to get into some community-focused conversations. Now, there's some schools in the Upper West region in Wa. Now, the challenge has been a lack of educational infrastructure, ostensibly furniture that are needed in schools. It's really been challenging. And about 309 schools in the area, but only about, just 1/3, 70% do not have furniture. 1/3 of them have furniture. It's a very difficult situation. We have a story for you, a report for you by our colleague Latif Mahama. Let's take a look at it. When we come back, we'll delve into some conversation and try and speak to some people.
Access to good quality education is enshrined in the 1992 Constitution of Ghana. The Constitution under Article 38 states that the state shall provide educational facilities at all levels and in all regions of Ghana, and shall, to the greatest extent feasible, make those facilities available to all citizens. However, basic schools in the Wa West district appear to be missing out on this right, as they have no furniture to sit on during instructional hours. Citi News checks in some of the schools indicate that teachers are conducting lessons in dilapidated classrooms that have no furniture. The Wa West District Director of Education, speaking at a short ceremony to receive furniture from the District Assembly, bemoaned the situation, saying it has adversely affected learning outcomes over the years.
We have 309 schools in total, 110 KGs, 111 primary schools, and 88 JHS schools. So this is a huge number of schools that we have within the directorate. And less than 1/4 of these schools can boast of furniture. If you go to some of the schools currently, you can't find a single furniture in some of the classrooms. Children are still lying on their bellies to write. Most of the time when you go to do inspection at the school, you just feel like weeping. Because if this is the way we are treating the younger ones, then our future might not be the best. Will you blame the child if he doesn't have a desk to sit on and write? If he goes to write the exams and fail, will you blame him?
The Wa West district scored less than a 20% pass rate in the last BECE. The district chief executive for Wa West, who presented the furniture on behalf of the assembly, decried the situation and indicated that it is of great concern to all stakeholders.
Our basic schools are challenged with so many problems, and that hinder the progress of teaching and learning in the basic schools. The district assembly is supposed to ensure that our schools have adequate learning facilities that will enable them to learn well and write the BEC exam and pass properly. And so we have started tackling these educational challenges one after the other. We are gathered here this morning to hand over these pieces of furniture so that the school children will continue to sit on them and learn properly. We are equally tackling the infrastructural situation in the district. And so after this, we also tackle that one. And as you can all see, the furniture has been well procured. We have 724 dual decks this morning to be given to our basic schools to be using, while we'll continue to procure more. Early last year, we procured 400 pieces and gave out to some of the schools. Even before we procured the 400 pieces, we received some from local government ministry, 200 pieces, and equally gave them out to the schools. This morning again, we are here to hand over the 720 dual decks to the Education Directorate to distribute again to our schools. Of course, The basic schools in the district are really challenged with furniture. And even with this second batch of furniture we are giving out today, plans are still underway by the district assembly to procure more furniture.
She said the assembly is embarking on a rigorous agenda to resource all schools with the needed furniture and logistics to help improve learning outcomes in the district.
And we just saw that report. But my question right now is, how did we get here? How did we get here? 70% of the schools in that district do not have furniture. And sometimes I feel like these people in charge of, these issues actually downplay how important it is for students, because these are the same students that we want to pass the BECEs.
Yeah.
These are the same areas that we want children to be in school. And these are the same places that we want teachers to go and teach.
Yeah.
But it's not favorable for anyone.
Yeah.
And I'm beginning to feel like they think it's only about the aesthetics. But
Yeah.
they forget that, all these furnitures are important, not just for aesthetical reasons, but, for functionality, for safety, and even comfort of the kids in making the right environment for them to actually stay and learn.
No, I don't understand why we keep doing this to ourselves. Because you see, you're going to build a school. Building a school is the expensive part of the project.
Exactly.
Providing furniture, so we have we're going to talk to the GES director for Wild West. This is Ametis Tuhu. Good morning. Welcome to Breakfast Daily.
Yeah, good morning.
Hello?
Good morning.
Yes,
morning,
welcome
sir.
to Breakfast Daily.
Thank you.
All right, so this situation has come to our attention. We just aired the report on the Wild West basic school infrastructure and the challenges. So many schools, 309 of them, but only 1/3 of them have furniture in there. How did we arrive at this situation?
Thank you so much, and good morning to all those listening to this program. I am just a new person there. I've been reposted to the district for about just a few months now. And when I went and met the situation as it is. So as to how we came about it, I went and met it when I was reposted to the district.
So the question that would come immediately after hearing you say that is, when you went, were there no records of what has happened prior to your arrival?
Thank you for the question. But before I come to answer your question, let me paint this picture for you to understand how things are. Wild West is a rural district that is made up of 312 schools.
Okay.
We have one senior high school and two community senior highs, then 88 JHS, 111 primary schools, and then 110 KG schools.
Okay.
If you look at the enrollment in these schools, we have 1,092 at the SS level, that is the senior high level.
Okay.
We have 5,776 at the JSS level. Then we have 19,260 at the primary school level.
Okay.
And we have 7,447 at the KG level.
Okay.
This will give you roughly about 33,575 people attending school in the directorate.
Okay.
The question you asked, you wanted to know what?
I wanted to know that were there no records
Yes,
of what had
so
happened prior to your arrival?
So all these figures that I'm giving to you, is as a result of when I went there that I went into the records. I have to go around and collect all these data. And when we collected this data, that I got to know how serious the situation is. Please, if the line is not clear, I'm in transit. So that is why you may not hear me properly.
No, you
It's
go ahead.
fine,
We're
it's fine,
listening
sir.
to you. Just go ahead.
So I went with my officers when I was reposted there. We went around the schools, and then indeed, you get to understand that some of the schools you don't even have a single furniture in it. And it was there that I gathered all this information as I'm talking about. So there were no record, but we did it. We collected some data on the furniture situation in the directorate.
Okay, so part of what you've done since you came into office a few months ago was to actually gather data on the schools that are there in your district so far, right?
Yes, yes.
Okay. What are your plans as far as fixing the situation in Wild West?
Yes, I was just painting the picture for you to appreciate it. I didn't finish, and then I have to ask that question. The furniture situation really in Wild West currently, we need about 19,864 furniture for the directorate, and this one was I did this in 2021-2022 academic year. Getting to the latter part when I was sent, that we did this assessment, I realized that we needed 19,864 furniture.
When you say sorry, sir. When you say 19,000, are you talking about the combo desk chair?
The dual desk that can take about 2 or 3 people sitting on it.
Okay, all right, that one. Okay.
That's what I mean.
Okay, all right.
So and you see the kg. At the kg level, we needed 3,867 furniture, and at the time we collected the data, only 1,051 was present. That is what we had at hand.
Okay.
So, which means that we had a shortage of 2,816. Then at the primary level, we needed 9,806 furniture, but what was at hand was 3,781. Okay. Giving us a shortage of 6,025.
Yeah.
At the JSF level, we had 5,991, which was needed, and what was at hand was 2,627, giving us a shortage of 3,364. Now, when you add all these shortages together, you will see that we needed to have gotten 12,206 furniture to add to what was currently in the system. Hello?
Yes. We're listening
so we needed 12,206 furniture to add to what was existing.
Yeah.
That was the 2021-2022 academic year.
Okay.
Luckily, on my part, early part of this year, I engaged on community sensitization that has increased the enrollment again, which means that this number 12,206 that we needed to augment the situation probably might not help now that we have been able to get so many children being enrolled for this current academic year. So which means that we may probably need a little more than the 12,206 furniture that I'm talking about as a result of the new enrollment improvement in the new enrollment that we had from this academic year.
Okay. So then the question then comes is, what are you doing as far as getting funds?
What I have done so far is that I have spoken to all stakeholders, the assembly, and then I've spoken to the MP, and I must say that the MP did well. He was able to provide us 400 dual decks, which has been distributed. The district assembly also promised to give us 720, which we are yet to distribute to the schools. But notwithstanding all these interventions that we have had from the assembly and the MP, it is just a tip of the iceberg. So aside the assembly and the MP, we are also writing to other benevolent organizations if they could help us to salvage the situation for us. So this is what I'm doing at the moment.
I see. All right.
Yeah.
it seems like you have a tall task ahead of you, and hopefully in the next coming months there'll be people that will reach out, you know, to maybe even after this story. Let me ask you, how much does one desk cost? Just to give us a sense.
That one, the current one that the MP asked us to construct, I think but I don't know the unit cost. I'm not a technical man. Maybe I will be able to. I will just consult those who have been constructing it to get you the unit cost per desk.
Mr. Director,
Yes,
it's a little troubling if you don't know the unit cost, because you are the one who is going to be advocating and soliciting for funding. So on what basis would you say, you know, we need X amount of money to get some desks, if you don't know the unit cost?
Yes, I'm saying so because you see, prices of items of late are not stable.
Fair enough. But
yes,
these are not things that are imported by you know, they are not shipped into the country. The wood is Ghanaian wood, so that those prices will not change as frequently and in a fluctuating manner like other products that you ship in, you know, into the country would change. So if wood is whatever X price, that price will not necessarily change too much over a period of, say, a month, right? So I don't know why, you know, at least, okay, at the last time you checked, you know, what would the price have been? That's just to give us an idea.
The idea was 500 per dual desk. 500 Ghana cedis per dual desk.
500 cedis per dual desk. Okay.
Yes.
The reason why I ask this is also because sometimes you have people that are watching and they get interested in the story. And if they have an idea and they say, okay, that doesn't sound too bad, I think I can do 100, or I think I can do 1,000. Then
so that is what I'm saying. The last one that we constructed, it was 500 Ghana cedis a dual desk.
Okay. All right.
Yeah.
Okay. Thank you very much. Yeah. Thank you very much.
Thank you.
All right.
Yeah, thank you.
We've been speaking with Mr. Ametis Tuhu, who is the GES director for WA West. All right. So.
Well, I think if care is not taken, it might get worse, because, like he keeps saying, that, you know, in the beginning they counted a certain number, but when the new school year started again, the number increased. It's always going to increase.
Yeah.
It's
and
always
he's
going to
actually been
increase.
campaigning for enrollment.
Yes.
So then it
exactly.
means that more people
are still going to come to school. More people are still going to need spaces and you know, great environments to be in, to learn. I don't know.
Yeah.
like it just makes me sad, especially like watching the report where the reporter said, no, was it the reporter or one of the guys said, some of the kids actually lay on their belly to write.
Oh yeah. But this is actually maybe one out of many that we've done over the last couple of years, where you actually see, you know, children in the dust, you know, on the ground. In the dust. On the ground, you know, writing, and you know, because how long can you even if you decide that you're going to sit on, let's say, a stone, how long can you sit for to write? So best posture, you lie on the ground, and it's unfortunate, but that's the reality of where we find ourselves. And all of this is under the Ghana Education Service, by the way, right? So my question is that if you're going to expand the school system and have school blocks and classrooms, right? What's the thinking? Are we just building?
What's the rationale? Just building
Are we
and
just
not
building
having
infrastructure and then having no furniture? I don't get that.
I don't get it.
Yeah, it doesn't make any sense to me.
Well.
Yeah. Anyway. Yeah. So we're going to look at another story. The Ghana Health Service this time has received a first consignment on vaccines. We're going to take a quick break. When we come back, we'll get into that story.
Welcome back if you're just joining us. This is Breakfast Daily, and now it's time for us to check out our second story. And the GHS receives first consignment of vaccines. We're going to be talking about that. But before we do that, let us check out a report we have on this story.
On February 7, 2023, Citi News broke the story about measles outbreak and the shortage of vaccines in the northern region, with the Tamale metropolis alone recording over 70 cases. Mothers who visited various health centers for routine immunization of their babies were left helpless, a situation they bemoaned. Ironically, the Northern Regional Acting Director of Health, Dr. Brema Abubakari, downplayed the report and even inferred that there was no shortage of vaccines in the region. His response infuriated some mothers in the region who thought he was being extremely disingenuous. Following public outrage that greeted the occurrence, the Director General of the Ghana Health Service confirmed a nationwide shortage of vaccines on the Citi Breakfast Show, contradicting the initial response of the Northern Regional Director. The Health Minister subsequently appeared before Parliament to offer explanation. On March 11, some vaccines finally arrived in the country for onward distribution. On Monday, March 13, the Northern Regional Health Directorate began the distribution of childhood vaccines to various districts. At the time of Citi News' visit to the regional medical stores, 8 out of 16 districts had already picked up their stock. According to the Regional Directorate, all districts will receive their vaccines by Tuesday. With the arrival of these vaccines, Citi News can confirm that the region currently has all the vaccines under the expanded immunization program. However, officials are concerned that these vaccines can only last for a few weeks. Hence, the need for government to fast-track the arrival of more vaccines.
And that is a report by Diana Ngong, our Northern Regional Correspondent. And we also have a report from the Ashanti region by our correspondent, Edward Opong Mafo. Let's check it out.
According to some nursing mothers in the Ashanti region, in recent months, they have been living in fear since their babies have not had a full complement of the vaccines they are expected to take. Citi News' checks show that as of Monday afternoon, many health facilities were yet to receive the vaccines. The authorities at some facilities stated that they were expected to receive the vaccines but had not received them at the time. Some health facilities, on the other hand, confirmed to Citi News that they had received their share of the vaccines. For instance, at the Sintresu Government Hospital, the head of the Public Health Department, Felicia Efwa Edia, noted that they have received all required vaccines and are urging nursing mothers to start visiting their facility by Tuesday.
Today, we were able to go to the regional cold room to collect the quantity of vaccines we are supposed to work with. So now, we are having polio vaccines, we are having measles, we are having BCG. Then we are also having rota, yellow fever, IPV, penta, and all the other vaccines that were not available. We are now having them. So tomorrow, God willing, all caregivers and nursing mothers can bring their children to Sintresu Government Hospital to receive the vaccines that their children are due. We were having some of the vaccines available, and there were some too that we weren't having. So now we've gotten all the vaccines that are needed by the children at the facility. I would say that we have enough. So for now, any vaccine that they need, we have. So they shouldn't say that if our population is around 30,000, all of them shouldn't come tomorrow. For sure, we are working within from tomorrow up to when the vaccines will get finished. But we have enough, so they shouldn't rush, even though it's needed that the right timings should be given.
All right, so that's a report by our colleague Edward Opong Mafo, who is our Middle Belt Bureau Chief, and bringing a report from the Ashanti region. as to what has happened since the vaccines arrived. Now, what I find curious, and I can't wait to get Edward on the line, because what I find curious is that the report that came yesterday was that 3 of the vaccines that were needed had arrived.
Yes.
Okay. But now the nurse who was speaking says that they now have all the vaccines that they didn't have previously. So some clarification is needed here as to what exactly is going on.
And for me, like, all I just want to know is how long will this batch of vaccines last? Because people are not, not because of you, people are not giving birth. People are still giving birth every day. So obviously mothers are still going to need this. So how long is this going to last, and how long do we have to wait again? That's what I really want to know. But nevertheless, I'm really excited that it's here now.
Well, I mean, the thing is, so, let me just show you something here. There's a story that is on CNR. There are 2 stories that I want to refer to. One of them says health officers from various municipal and district assemblies rush, or they're currently massing up. These are the health officers massing up at the offices of the Greater Accra Regional Health Directorate to take delivery of childhood vaccines. These are the health officers massing up, okay, to take delivery. Now, child immunization is expected to resume at various health facilities after months of interruption due to shortages of vaccines nationwide. This follows the arrival of a consignment of the vaccines in the country over the weekend received by the Ghana Health Service. Distribution is ongoing at the Regional Health Directorate, and health officers are taking delivery. In an interview with Citi News, they said they are hopeful that the vaccines will be enough for every child. But here's the question. You're asking, how long will it last for, right? In a related development, the Northern Regional Health Directorate has also begun the distribution of childhood vaccines to various districts. At the time, Citi News' visit to the regional medical stores, 6 out of the 16 districts had already picked up the stocks. Okay, there are various stocks, and the story goes on there. Now, let me take you to the other story that we have here on Citi Newsroom. Now, it says here, recent childhood vaccines received by Ghana was from Nigeria. Okay. Now, the Member of Parliament for the North Tongue constituency, Samuel Okujeto Ablakwa, has alleged that the vaccines Ghana took delivery of over the weekend were from Nigeria. He said it was an act of benevolence following Ghana's current vaccine challenges, but will be replaced. Ghana took delivery of the first consignment of the measles vaccine, BCG vaccines, and the oral polio vaccine.
So that's 3.
3.
3.
Do you see?
As you said earlier.
Yeah. 3. So it's measles, BCG, which is a combo vaccine,
and the
oral polio vaccine. Okay, to supplement the acute shortage that rocked the country since October 2022. Now, remember that so the story goes on. Although the Minister of Health, Kweku Agyeman-Manu, in Parliament last week said that he had paid UNICEF to deliver the vaccines within the next 3 weeks, the North Tongue lawmaker argued that the government must be transparent with Ghanaians. He said the vaccine consignment came in from Nigeria as a benevolent gesture which the Ghanaian government has promised to replace when it finally puts its house in order. Pause and think. There's absolutely nothing wrong saying thank you to a neighbor who exhibits superior public health policies, better prioritization, and who responds positively and swiftly when you come begging. Ghanaian officials should not be concealing this fact and therefore appearing ungrateful within the country, within a community of nations, even though I acknowledge that an honest and transparent narrative from the government will further expose false claims by President Akufo-Addo during his message on the State of the Nation last week. that childhood vaccine shortage was a global phenomenon. So his argument is that if it was a global phenomenon, how would Nigeria have enough
Why did you get from
to
Nigeria?
spare? Because they would also be in shortage.
Wow.
You know, that's the argument
Wow.
here. Mr. Blackwell further, and he posted this on his Facebook page, by the way. Mr. Blackwell further attributed the shortages that have put many newborns in danger to the government's incompetence and blatant disregard for the World Health Organization's warning sometime last year. All right. So we've been joined on the line by our colleague, Edward Opon-Mafo. Edward, good morning. Eddie, good morning. Hello, Edward.
Yeah, hello, David.
Yes, good morning. Welcome to Breakfast Daily.
Good morning, David. Thank you.
Yeah, so I'm a little befuddled by the statement that one of the nurses made in the report you brought to us about how that all the vaccines that they were lacking are back now and available. But according to reports, the initial set of vaccines that came in were three of the vaccines: the measles, the polio, and the BCG. What's going on here? What do you have in terms of updates?
Yeah, so, David, what so far we have gathered is that, in fact, there are some facilities that yesterday in the evening, they have not been able to receive the vaccines. And so the authorities that we spoke to, the medical superintendent and the other people who are in charge of those ones, they indicated to us that, well, they are still liaising with the regional health directorate, and they have been given assurance that indeed they are going to be supplied with the vaccines. And so they were expecting them. And in fact, there were some facilities that indicated to us that they went to the regional cold room and they have received the vaccines. And so for them, everything was okay. And so they were not able to start the administration of the vaccines yesterday because looking at the time, they had to document some few things and all that. So there were some nursing mothers who had visited the various facilities and were expecting to receive it. And with the announcement that came out, they felt that, well, let's rush and get it because it could be a short supply again. And so they rushed to the various facilities and they realized that, well, these vaccines were not available, as in were not readily available to be given to their baby. So that was the situation. This morning, I've engaged some nursing mothers and they are saying, well, they are anxious about the fact that some people that I spoke to earlier, they said, well, they are hoping that they will get to the facilities and get them. But with the other people who are in charge of the administering of the vaccines, I've spoken to those at Central before starting this report, and they have indicated that they, for instance, are working towards it, and that any mother who comes around, they are going to ensure that they will be given the vaccines, the babies will be given the vaccines. We've also spoken to some other authorities at various facilities. They have also given the assurance that once people come around today, even if they are not set, they said they have to make some arrangements and all that. So once they are set, they will let the people wait in line and then they'll be served. And so that's how they're going on with it.
What do you have as far as the health directorate is concerned regarding expectations for the replenishment of these vaccines? Because from what we hear, these vaccines will not last more than a few weeks. Edward, can you hear me?
Yeah, I didn't get that.
No, I was asking that, what have you heard as far as the health directorate is concerned? Because as far as we know, the vaccines that are coming in or that have come in so far will not last but a few weeks.
Well, we have actually, we have some sources at the Regional Health Directorate, and they have indicated that indeed, from what the information they have and what they are supplying to the various facilities, based on the figures that all those ones have, they feel that within this period, before the next vaccines come in, these ones will be able to serve the people that troop into the various facilities within this period. And so that's the assurance that they have given them. And the various facilities too, in fact, we've engaged some of them, and they're saying that based on the consignment given to them, they are hopeful that it will be able to serve their people. But just to be sure, at least, because they know that now a number of nursing mothers who visited these facilities and their babies were due to take these vaccines, but they were not able to take them at the right time. And so since they were not able to take these vaccines at the right time, they feel that a lot of people will be rushing and others are also going to be due in no time. So they feel that the relevant authorities to ensure that they have enough vaccines and there wouldn't be a shortage again, and some nursing mothers will start raising these concerns again.
Right.
All right.
Edward, I just want to ask, have you spoken to any nursing mother recently, and how do they feel with the arrival of the vaccine right now?
Well, yesterday, I spoke to some parents and particularly nursing mothers, and Chris, what they were saying, they were basically excited about the fact that there's this assurance. Indeed, some facilities are confirmed that they have received and they are calling on them to come and receive the vaccines. Some were anxious, some actually felt that, well, they could fall victim because already they had heard of reports where some babies had contracted the measles and all that. So they felt that, well, it could happen to them. And so some kind of action needed to be taken. And so this time around, it's just more of excitement, but they feel that it shouldn't just be for a short period. Just once this issue is resolved within a short period, then another one comes in. They feel that the issue of vaccines should be prioritized. So these things will be done well ahead of time, and a similar situation should not recur.
All right. Edward, thank you very much for the update this morning. We appreciate your time. Thank you. All right, so that was our Middle Belt Bureau Chief, Edward Opoma, for bringing us up to speed as to what's happening with the vaccine arrivals and distribution within the Ashanti region. And so, I mean, really, I think that I would definitely like to find out what's the real story behind what's going on.
If it's either paid for,
yeah,
or if it's a gift,
yeah,
from Nigeria.
Yeah, and then the vaccines that the health minister says they've paid the UNICEF organization for, where are those vaccines? He says within 2 to 3 weeks they should be here, right? And so let's keep our fingers crossed. Hopefully.
Oh wait, maybe. You know, the nurse earlier on, she named about 4 or 5.
Oh, she named about 7 of them.
Yeah, well, yeah. So she named all that. Maybe those are the ones that they paid for. The Nigeria still gave them.
No, but we've not. No, but we've not. So the assumption we made was that, well, I mean, you can't even make assumptions. The plane has landed.
Yeah, exactly.
They're taking vaccines off,
yeah.
right? So this thing that the Honorable Ablakwa has brought out then starts to raise, you know, other questions.
And questions.
Yeah, as to
but let's always remember it's alleged. We don't we don't know the real story there.
Yes. You know, so I just hope that, I mean, we do the right thing here in terms of making sure that this thing doesn't repeat itself, you know.
And there should be a bit of transparency.
I think that part of where we are is just poor planning.
Yes.
You know, because you know your vaccine uptake every year. Every year you give vaccinations. You know how much goes out every year, right? So you plan. So how is it that the planning didn't go right, that we've been short since October?
True.
That's a problem.
Yeah.
That's a problem. And we're not getting the answers that we really need. In
like
terms of everybody's trying to defend their turf, trying to explain the thing in a way, but I don't understand all of it. Anyway, this story is not going anywhere anytime soon.